Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Bringing a child in for an X-ray or CT scan can feel overwhelming for both young patients and their parents. But pediatric imaging is not just taking an adult scan on a smaller scale. Today, we are exploring pediatric imaging. We will explain how care teams keep children comfortable while breaking down child-specific exposure charts, motion reduction techniques, and image gently protocols for our technologist community. For parents, preparing your child starts with honest, simple communication. Children pick up on adult emotions, so remaining calm and supportive makes a world of difference. Technologists use child-friendly language, like calling the X-ray machine a big camera taking a picture of their bones. We also use light projectors, games, and bubbles to turn a potentially scary room into a welcoming, comfortable space. Parents often ask about specialized equipment like the Pigg-O-Stat used for infant chest X-rays. It is important to know these are gentle safety positioning aids, not painful restraints. Infants cannot hold their breath or stay still on command. These soft, supportive devices keep your baby upright and completely still for a fraction of a second, ensuring we capture a crystal clear image on the very first try without needing repeat exposures. For our technologist and student community, Pediatric Radiobiology demands strict adherence to ALARA principles. Pediatric tissues contain a higher proportion of rapidly dividing, undifferentiated cells, making them inherently more radiosensitive than adult tissues. Furthermore, children have a longer statistical life expectancy in which latent radiation effects could manifest. Every exposure parameter must be customized directly to the child's body habitus. To standardize pediatric protection, the Image Gently campaign provides evidence-based guidelines across diagnostic modalities. Never use adult default settings for pediatric patients. In CT, adjust tube potential and tube current modulation based on measured weight or cross-sectional diameter rather than age alone. Sizing parameters correctly maintains diagnostic image quality while reducing radiation dose by up to 50% or more. In pediatric projection radiography, motion blur is the leading cause of repeat exposures. To eliminate motion, select the highest achievable generator MA paired with the shortest exposure time, often under 5 milliseconds. For infant chest radiography, watch the respiratory cycle closely and trigger the exposure at peak inspiration, which often occurs at the top of an infant's cry. Scatter radiation dynamics differ significantly in pediatric patients due to smaller tissue volume. For anatomy under 10 centimeters thick, remove the anti-scatter grid entirely. Because small body parts generate minimal scatter, removing the grid can reduce patient dose by 50 to 70% without sacrificing image contrast. Always combine grid removal with tight, four-sided manual collimation directly to the area of interest. Advanced CT processing algorithms play a massive role in pediatric dose reduction. Iterative reconstruction and deep learning noise reduction algorithms restore signal-to-noise ratio in ultra-low-dose scans. Additionally, dropping tube potential to 70 or 80 kVp shifts the average photon energy closer to the K-edge of iodine, boosting intravascular contrast enhancement while using lower contrast volumes. Applying child-specific physics allows pediatric care teams to answer critical medical questions safely and precisely. By matching modern technology with compassionate care, we obtain high-resolution diagnostic images that guide life-saving treatments while keeping radiation exposure to an absolute minimum. Pediatric imaging combines advanced technology, strict radiation safety, and gentle care to keep our youngest patients safe. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.